Many people suffer from sciatic pain, and it can be a bear. It can be so painful and really up close and personal in terms of being able to see out. So we want to talk about sometimes sciatic pain can just stay in the buttocks, and sometimes it can go all the way down the back of the leg and even wrap around to the front of the foot. When we work with sciatic pain, we're remembering that we're working with that nerve. So a lot of things traditionally to help sciatic pain are things like a figure 4 stretch, maybe on your back or seated, holding on to something to stretch out the musculature and the fascia in that area. But when we're dealing with a nerve, sometimes that can pull on a nerve that is feeling frayed or dehydrated or taut. And when we pull on that nerve, you think about it like a rubber band that doesn't have so much give to it, it can easily get more irritated. So today's practices are all about trying to calm that nerve and actually shorten that nerve. Anything like hamstring stretches, again, seated or standing, usually for sciatic issues, that's going to just exacerbate your nerve pain. Sometimes while you're doing it, it can feel really good and you think, oh, this is great. I'm working to alleviate some of that pain. But generally all we're doing is continuing to irritate that nerve. So I want to show you a couple of things today that may help to open up some space to begin to get a little bit more blood flow through that area so that we can have some glide and ease with the nerve. So the first thing is that we're going to try not to go into more of that movement towards 90 degrees with the leg. So if I have a right sciatic issue here, anything that I do that's coming forward is pulling on that sciatic nerve even more. So maybe you're in the grocery store line, maybe you're washing dishes, but what would happen if you simply take that affected side leg behind you a little bit? So again, we're beginning to shorten the nerve pull. Now this may not solve the solution, but for that moment it might give you a little bit more reprieve from the pulling or the pain. You could try with your heel up or just with your foot down, shifting your weight a little bit, noticing that. Sometimes you can grab something like countertop or a piece of furniture and bring your leg up on a chair or a coffee table so that again you have a little bit more shortening of this back body chain. So that's step one. Another thing I say when you have sciatica is when you're seated to try to keep your hips higher than your knees. Now this is very difficult in a car because we have a lot of cars that we sit in and our pelvis starts to round and we shorten those hamstrings and everything gets a little bit congested. So if you have a seat, maybe it's by your computer, maybe it's your dining room chair, that you can build up a little bit with some blankets or pillows. Blankets are a little bit better because of their firmness, but see what feels good to you and simply come to the edge of the chair so that you're seated and your knees are a bit lower than your hips. Now for some of you, check it out, you might even like coming towards the edge of your chair and taking your leg behind you a bit. That may provide a lot of relief because again, we're shortening that back of the leg, that pull on the sciatic nerve. Another option, these are all options to try to provide some relief, almost like a little mini vacation for the sciatic nerve. But another option is to take your leg up on a chair. It could be a coffee table, maybe there's an ottoman, or a sofa in your home that you can use. The height is what you want to find that's really comfortable. So keep exploring to know what height feels good. It might be that you just build up a bunch of pillows and blankets yourself. But check it out, this is my affected side. This is the side that has some sciatic pain, and I'm gently going to rest my leg on this chair with a little bit of height. So you can see how my knee is above my hip. This is also really nice usually for that quadratus lumborum muscle that is back here that sometimes we rub when our back is really tight, and for a lot of the muscles and the rotators in the hip. So this just gives it a nice shortening. And you want to get really picky here about how comfortable you are. So it might be that you need a little bit more support with your knee more on the chair. And notice where you want your pelvis, if you want it a little shifted forward or back. Be very particular here to get super comfortable and allow that to rest. And then you can rest in this position for as long as it feels comfortable. Sometimes people find that they want to start to go to sleep that way. And so then that helps them get to sleep. And some people do it a few times a day for a few minutes each time, and notice how that might help bring a little bit more ease to the sciatic. The other thing that you might try is thinking about how to very, very gently increase the glide in the nerve. So we're working on not stretching it and pulling it apart, but we're working on hydrating it and allowing that ease to come in so that blood flow can get to the area and the nerve can heal. So another option is to come onto your belly and take your feet together and notice a little bit of movement back and forth. So right now I'm simply rubbing the sole of my foot down the inside of my leg. Now for you, this might be painful, and if it's painful, we're not going to keep going. Make sure that you're working within your comfort level. So nice and easy. It might be that it looks very small, or you might simply imagine or pretend that you're doing that movement. And then you could get really creative. What else feels good here? Maybe little circles of your ankles in the air. Maybe a little back and forth, crossing your ankles, one over the other through the space. And as you do this, the hope is that you're gently providing some ease in that sacroiliac joint. A little bit of micro movements to begin to help open up space where that sciatic nerve follows through. So you can just rest your head, get comfortable here, check out what direction feels good with your legs, your feet moving around. It might be that you come to, with your legs extended all the way out, and do a very gentle rocking back and forth. Just micro movements. And the hope is that those micro movements begin to build to bigger movements, and then the sciatic nerve has a lot of space to do all kinds of things that you want to do in your life. I hope that helps. Take care out there. Thanks for being here.